This is MedicareMark. We get clear solutions to your Medicare questions. Are you turning 65? Were you currently on Medicare? Well, in this webinar, you're going to learn about all your Medicare choices. On the right here, you see what the current Medicare card looks like. It came out in April 2018, and the big difference is it removed your Social Security number from the card. Now your Medicare numbers are just a bunch of letters and numbers. And I'm MedicareMark. What we will cover: we're going to talk about original Medicare and its 4 parts. You basically have 2 choices: Medicare Supplement or Medicare Advantage Plan. We're going to talk about what does Medicare cover. What is a Medicare Supplement plan and how do you compare it to others? What is a Medicare Advantage plan and how do you compare those? We're going to talk about Part D prescription drug plans. Also, important enrollment dates. And finally, late enrollment penalties for Part A of Medicare, Part B, and Part D. We call this webinar The Truth About Medicare. A little bit about me. I was born in Trenton, New Jersey, and raised in Fort Lauderdale, Florida. I'm married with 4 children. I've been licensed since 1989 and an independent broker since 1994. I am a Medicare insurance expert. I'm Mark Lumia, a licensed insurance agent and agency owner who's helped thousands of clients and counting get the most out of their Medicare coverage. As a guy with both parents on Medicare, I know just how important it is to get access to the full benefits of your Medicare coverage. Before you make this really important decision, it always pays to be informed of what options are available for your specific needs and situation. Here's proof that I'm a Medicare expert. This is USA Today. In the Money section, a full-page article, and Robert Powell, in the picture right there on the left, the top of the article, contacted me, the picture above the lady on the bottom, to ask and answer any Medicare question. He interviewed me, and I contributed to this article, which was in the national newspaper. You won't see many Medicare experts in the paper. Very few people have ever been in the USA Today talking about Medicare, and I just happen to be one of them. As a 100% independent agency, I represent Medicare Supplement and Medicare Advantage companies. I am not controlled by any particular insurance company to steer a person onto any one particular plan. What we will cover, and here's a few benefits that I offer. I'm non-biased. We hold Medicare focus groups to find out the questions that people want answered. We review your coverage every year if you're a client of ours to see what the changes are and what your options are. There's no cost for my help. We hold Medicare seminars. We have Medicare webinars. I have a podcast called the Medicare Minute, and we have a membership site called MedicareMark membership site, where you can get all the answers to all your questions. Understanding Medicare's different parts. Medicare comes in 4 parts: Part A, B, C, and D. Each covers particular services or types of insurance. Virtually everybody who gets Medicare eventually enrolls in the first 2 parts, which have been around since the program started in 1966. So virtually everyone will have Part A and Part B. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans like HMOs and PPOs. Medicare Advantage plans include Part A and Part B, and sometimes they have a drug plan attached, a Part D plan. And Part D is Medicare prescription drug coverage. You basically have 2 options on how to receive your healthcare benefits. On the first option, you can keep your original Medicare, purchase a Medicare supplement to cover the gaps and the copays, and then you would have to also purchase a Part D plan to cover your drugs. Or you can get on a Medicare Advantage Part C plan, sometimes called a MAPD, which means it's a Medicare Advantage with prescription drugs. So step 1, decide on how you want to get your coverage, either original Medicare or Medicare Advantage plan. If we go the original Medicare path, you can see you have Part A, hospital insurance, and Part B, medical insurance. Both of these have a deductible, and there is a co-insurance. Step 2 would be decide if you want a supplemental coverage to cover those gaps. And then you would purchase a Medicare supplement plan or what they call a Medigap plan. Then you have step 3. You have to decide if you need to add drug coverage. Well, then you'll be adding a Part D plan along with your Medicare supplement and along with original Medicare. Your other option is the Medicare Advantage plan, a Part C plan, where Medicare will prepay the companies to take care of you. And they're like HMOs or PPOs. A Part C plan combines Part A, Part B, and usually drug coverage, Part D. Then on step 2 of that route, you're going to decide if you need to add drug coverage. Part D prescription drug coverage. Most Medicare Advantage plans cover prescription drugs. You may be able to add drug coverage if some plan types do not already have it included. Now, there are Medicare Advantage loan plans, meaning they do not have prescription drugs. So that's where I'm talking about you need to decide if you want drug coverage. However, most plans do have that drug coverage. Okay, so here's Part A. Part A enrollment information. Since most people pay Medicare FICA taxes while they're working, 40 quarters for self or spouse, they won't have to pay a premium for the Medicare Part A plan. So if you worked 40 plus quarters, which is 10 years, you pay $0 a month for your Part A. That's 99% of people. If you work between 30 and 39 quarters, you're going to pay $259 a month for your Part A of Medicare. And if you worked less than that, from 0 to 30 quarters, you will pay $471 per month for your Medicare Part A. Now, let's say you have 37 quarters. Well, if you go back to work, within a couple of months, you could probably earn an extra 4 quarters, and then you'll go from paying $259 a month down to 0. We actually had that happen one time with a client of mine that was originally from the Bahamas, but he had dual citizenship, and his quarters fell low, and basically within 2 months, he got 4 extra quarters, and by going back to work, and then we had to pay 0 for the Medicare Part A. So you could enroll in a Medicare Part A anytime within the 3 months leading up to your 65th birthday, the month of your 65th birthday, or anytime within 3 months immediately after your 65th birthday. Here is original Medicare, Part A. You're eligible at age 65. There's no cost for Part A as long as you've worked 10 years or 40 quarters. It works with any hospital that accepts Medicare nationwide, which 96% do. Your Medicare benefits will restart after you're out of the hospital for 60 consecutive days. That's called a benefit period. So you go in a hospital, you come out, you're out of the hospital for 60 days, a new benefit period starts. And also, once you have used your lifetime reserve days, you have 60 lifetime reserve days, they will never be available again. So Medicare covers 90 days of inpatient hospital care. Here's how it works. You pay a deductible of $1,484 in 2021 if you have to use Part A Medicare and go into the hospital. Okay? That covers you for the first 60 days. That's called your Part A hospital deductible. You're not paying any amount. You're paying $0 for those 60 days per day. But you do pay the deductible of $1,484. Now, if your hospital stay goes in to 61 days to 90 days, you're going to owe $371 each day. That's an additional $11,130, which for a 90-day hospital stay would be $12,614. That's one of your gaps in just original Medicare alone. Now, after a 90-day hospital stay, you have a pool of 60 lifetime reserve days that you may use. The 60 lifetime reserve days are going to cost you $742 each day, which could be another $44,520. So that 150-day hospital stay would be $57,134. Remember, there's no maximum out-of-pocket or cap with original Medicare. Here's the Medicare and You 2020 book. Everyone is usually mailed a copy of this book, and it has information in the back of the book just based on your area. However, in this book, on certain pages, they talk about late enrollment penalties, and that's what we're going to talk about now. For Part A, there is a late enrollment penalty. It's found on page 21 of the Medicare U Guide. If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10%. You have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. Here's an example. If you were eligible for Part A for 2 years but didn't sign up, you'll have to pay a 10% higher premium for 4 years. Part B has a monthly premium. The standard Part B premium amount for 2021 is $148.50. Currently, in 2020, it's $144.60. So you can see it went up by $3.90. We had a 1.3% increase in Social Security that was announced in October of 2020, which goes into effect January 2021. So everyone's going to get a 1.3% increase in their Social Security check. However, the cost of Part B is going to go up $3.90, and if you're below individuals with income above $88,000 and couples with incomes above $176,000 will pay a higher Part B premium. But around 93% people fall below those thresholds and will not pay more than the $148.50. They look at your modified adjusted gross income as reported on your IRS tax return from 2 years ago to figure out what level you're on. Premium will automatically be deducted from your Social Security benefits if currently drawing, and if not, you're going to be paying quarterly by check, and you can set up monthly EFT auto pay from your checking or savings account. A little bit about Original Medicare Part B. You're eligible at age 65 but can delay if you continue working. Premiums start at $148.50 per month but could be higher depending on income. It works with any doctor or facility that accepts Medicare nationwide. So the Part B deductible is paid annually and may change each year. Currently for 2020 it's $198, but in 2021 you'll be paying $203 for your Part B deductible. After your Part B deductible, Medicare pays 80% and you have to pay 20% coinsurance. If a doctor does not accept assignment, the doctor may charge in excess of that, but only 15% above. That's called Part B excess. Remember, there's no maximum out-of-pocket or cap with Original Medicare. Now, if you don't take Part B, there is a late enrollment penalty. In your Medicare New Shopper's Guide of 2020 on page 22, it talks about that. If you don't sign up for a Part B when you're first eligible, you may have to pay a late enrollment penalty for as long as you have Part B. Your monthly premium for Part B may go up 10% for each full 12 months in that period that you could have had Part B but didn't sign up for it. If you're allowed to sign up for Part B during a special enrollment period, you usually don't have to pay a late enrollment penalty. So here's an example. Mr. Smith's initial enrollment period ended December 2016. He waited to sign up for Part B until March 2019 during the general enrollment period. His coverage starts July 1st, 2019. His Part B premium penalty is 20%, and he'll have to pay this penalty for as long as he has Part B. So even though Mr. Smith wasn't covered for a total of 27 months, this included only 2 full 12-month periods, thus the 20% penalty. Now, to cover the gaps of Part A and Part B that we just went over, you can get what's called a Medicare supplement or a Medigap policy. And here are some important facts. You must have a Part A and Part B. You pay a monthly premium for your Medigap policy in addition to your Part B premium. You cannot include prescription drug coverage. Costs vary by company and policy and may go up as you get older. Now, what I mean by you cannot include prescription drug coverage, you don't have that on your Medicare Part A or Part B. What you would have to do to get that coverage is purchase a Part D plan, which you can do. So guaranteed coverage. When you turn 65 or first enrolled in Medicare Part B, you have 6 months to choose a Medicare supplement plan without answering any health questions. After those 6 months, insurers can ask health questions and can decline your application if they wish. Now, with a Medicare or Medicare supplement or Medigap policy, they're accepted at any doctor, hospital, facility that accepts Medicare nationwide. And they also have standardized plans. So the Medicare supplement plans that you're able to get currently in 2020 and beyond, insurance companies can only sell you a standardized policy identified in most states by the letters A, B, D, G, K, L, M, and N. That means that different companies can charge different premiums for the exact same policy. Plan F and G also offer a high deductible plan. If you choose this option, this means that you must pay for Medicare covered costs up to $2,370 in 2021 before your Medigap plan pays anything. Now that's a high deductible plan. And I just told you before there's no Plan F, but there is. If you qualified for Medicare before January 1st of 2020, then you could still have Plan F. But from January 1st, 2020 on, there's no longer a Plan F option. Plan N will pay 100% of your Part B coinsurance, except for a copayment up to $20 for some office visits and up to $50 copayment for emergency room visits that don't result in an inpatient admission. So here is showing you different plans, Plan F, Plan G, Plan N, the initial premium, and it's showing you the increase every year in premium. So if Plan F, the red line, goes up 9% every year with rate increases, and Plan G goes up only 3%, and Plan N only goes up 3%. It's not only picking a plan that's important, you also need to look at the renewal rate history and why would one plan go up more than another. And that's where we can help you out. We can actually get a little bit of information from you, create a video just for you, showing you all the companies and what they charge, and we can also show the renewal rate history of those companies in your area based on the information you give us. So this chart is from the Medicare and Medicare supplement guides that you get from all the different companies, and this is showing deductibles for 2019. They have not sent out the books yet that have the updates that show 2021 rates. So we'll just go over it. Let's say you pick Plan G. That's your, remember I told you, deductible. This deductible shown this year is $1,364. Okay? If you took Plan G would cover that $1,364 and you'd pay zero. And then if you had to pay $341 a day from day 61 through 90 back in 2019, the plan would also pick up that $341 a day. And if you stayed in there for the 60 lifetime reserve days, it would cost you $682 a day back then. Well, the plan would also pick up that $682 a day. The skilled nursing coinsurance, Medicare usually pays the first 20 days, but then they charge $170.50 a day back in 2019 for the next 80 days, day 21 through 100. You would pay zero on Plan G. You would also pay zero for the first 3 pints of blood and for hospice care. So on the Part B side, that was the Part A side, now this is the Part B side. On Plan G, a couple years ago, the deductible was $185. Currently it's $198, and in 2021 it'll be $203. And Medicare pays zero of that. Okay? The plan will pay zero of that, and you would have to pay that Part B deductible. Currently, like I said, $198, and next year, $203. Plan G does cover the Part B excess. So if a doctor doesn't accept Medicare's payment in full and charge you 15% over and above that amount, you can see the plan would pick up 100% of that, and you'd pay zero. Medicare supplement or Medigap policy will help cover those gaps. So how do you compare those apples to apples? Basically, we take a little bit of information from you, your zip code, whether you're a smoker or non-smoker, male or female, your age or your birth date, and we plug this into a computer that spits out the results for your area and for your conditions, what you would have to pay for, say, Plan G. So this is an actual zip code. I believe it was 34476, but if not, it still pertains. And it shows you some of the companies and what they charge. And I only put up 5 here. I put up the least expensive company. Company 3 is $166.13. And you can see the most expensive company was $241.06. That's like a $75 difference, almost $900 for the same exact plan in monthly premium. And then you can see other premiums from other companies. Now, This list wasn't just 5 companies. It was probably 20 or 25 companies. I just wanted to show you how you do an apples-to-apples comparison. And since they're all standardized, you're usually looking at the top 3 companies that have the lowest premium. However, if you decide to get on a Medicare Advantage plan, a Part C plan, it's a little bit harder to compare. Because most of the plans that I've seen have a 0 premium, but there are plans that have premiums, depending on if you're picking an HMO or a PPO. They all can have a 0 premium PPO, a 0 premium HMO, but they also might have a cost for the plan based on how the company designs their plan. Now remember, the company can have multiple plans in the same zip code, and different plans are for different people. They can have what's called a special needs plan. So, on a Medicare Advantage plan, you usually have doctor networks. Drug formularies are with Medicare Advantage plans because Part D is built into the plans, a lot of them. On a Medicare supplement, in the previous slide, you would have to buy a standalone Part D plan to cover your drugs, and they would also have formularies. You would have co-payments and out-of-pocket limits. And on these Medicare Advantage plans, these can change every year. Thus, every year during annual enrollment period, they call that AEP, October 15th to December 7th for January 1st change. You can make changes based on how the plans change. Some plans' benefits will become better, some will become worse, and you have the ability to change. Sometimes you have a doctor on one plan, then moves to another plan, and some people may change for that reason. Everybody has a different situation. That's why we do the annual review during AEP to help make sure you're on the correct Medicare Advantage plan, Medicare Supplement plan, and the Part D plan. Now there's Part D prescription drug benefit. If you have a standalone supplement, you can get a standalone Part D plan. Here are some important facts. Prescription drug plans may have a monthly plan premium and an annual deductible. Prescription drug benefits work off a calendar year, January 1st through December 31st. The plans use formularies. This is a list of individual drugs covered by a plan, and the same plan may have multiple formularies because they offer different plan options. So there's different tiers. Most plans place drugs into tiers or levels, tier 1, 2, 3, 4, 5, or 6. Each tier has different copay and coinsurance associated with it. Some plans may offer a 4-tier plan. Some have 5 tiers, some have 6. Now, generally, if you have a 4-tier plan and you're comparing to a 5-tier plan, well, the 5-tier plan might have taken tier 1 and created 2 tiers, a generic and a preferred generic. So now you're comparing tier 2 versus tier 3 when you're trying to compare plans. We will also help do that. You can give us a list of your drugs, how much you take, 10 milligrams, how many times a day, 2, and we can go to the Medicare.gov website, plug that information in for you, or you can do it for yourself, and then help you determine what's the best drug plan for you if you're going the Medicare supplement route based on your drugs. And we can also do this for the Part C plans. Now, some drugs will require prior authorization or quantity limits. Some drugs require you or your prescriber to contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for the plan to cover it. Quantity limits say how much of a medication you can get at a time. And there's also something called step therapy, which requires you to try one or more similar lower-cost drugs before the plan will pay for the prescribed drug. Basically, maybe there's a generic before you get the name brand. Now, under Part D, they also have a penalty. The penalty is 1% of the national average premium for every month you waited. In 2020, the Part D national base beneficiary premium is $32.74. So once again, in the Medicare and You guide, the 2020 guide on page 77 to 78, we're going to show you the late enrollment penalty for Part D. D as in dog of Medicare. The late enrollment penalty is the amount that's permanently added to your Part D premium. You may owe a late enrollment penalty if at any time after your initial enrollment period is over, there's a period of 63 or more days in a row when you don't have Part D or other credible prescription drug coverage. You generally have to pay the penalty for as long as you have the Part D coverage. Note, if you're getting extra help, you don't pay a late enrollment penalty. The cost of the late enrollment penalty depends on how long you didn't have credible prescription drug coverage. Currently, the late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium, which is $32.74 in 2020, by the number of full uncovered months that you were eligible but didn't join a Medicare drug plan and went without other credible prescription drug coverage. The final amount is rounded to the nearest 10 cents and added to your monthly premium. Since the national base beneficiary premium may increase each year, the penalty amount may also increase each year. After you join a Medicare drug plan, the plan will tell you if you owe a penalty and what your premium will be. So here's an example. Miss Martin didn't join a drug plan when she was first eligible by June 2017. She doesn't have prescription drug coverage from any other source. She joined the Medicare drug plan during the November 2019, and her coverage began on January 1st, 2020. Since Miss Martin was without credible prescription drug coverage from July 2017 through December 2019, her penalty in 2020 is 30%, 1% for each of the 30 months, of $32.74, the national base beneficiary premium for 2020, which is $9.82. The final amount is rounded to the nearest 10 cents, so she'll be charged $9.80 each month in addition to her plan's monthly premium in 2020. She'll continue to pay that penalty for as long as she has Part D coverage, and the amount may go up each year. Here's the math. 0.30, which is a 30% penalty, times $32.74, which is the 2020 base beneficiary premium, which equals $9.82. So $9.80 after rounding is Mrs. Martin's monthly late enrollment penalty for 2020, rounded to the nearest 10 cents. Now, here are 3 ways to avoid paying a penalty. Number 1, join a Medicare drug plan when you're first eligible. Even if you don't take prescriptions now, you should consider joining a Medicare prescription drug plan or a Medicare Advantage plan that offers drug coverage to avoid a penalty. You may be able to find a plan that meets your needs with little or to no monthly premiums. Number 2, enroll in a Medicare drug plan if you lose other credible coverage. Credible prescription drug coverage could include drug coverage from a current or former employer or union, TRICARE, Indian Health Service, the Department of Veterans Affairs, or individual health insurance coverage. Your plan must tell you each year if your drug coverage is credible coverage. If you go 63 days or more in a row without a Medicare drug plan or other credible prescription drug coverage, you may have to pay a penalty if you join later. And number 3, keep records showing when you had credible drug coverage and tell your plan if they ask about it. If you don't tell the plan about your credible prescription drug coverage, you may have to pay a penalty for as long as you have Part D coverage. So here's some important enrollment dates. Medicare Supplement or Medigap. Most carriers will let you lock in a price for your Medicare Supplement plan up to 6 months before your Part B effective date. And once your 6-month open enrollment period ends, you may have to answer health questions. This means you could pay higher premiums or be denied coverage altogether. Original Medicare and Part D or Medicare Advantage. Original Medicare can be done online at the SSA.gov website, in person at your local Social Security office, or you can call 1-800-772-1213. If you're already receiving Social Security benefits before you turn 65, your enrollment is automatic. You will get a Medicare card in the mail 3 to 5 months before your birthday. So, if you're already collecting Social Security, you don't need to do anything. They'll mail you a card 3 to 5 months before. But if you decide not to collect Social Security early, then you're going to need to call that number, go to that website, contact Social Security in some way, and let them know that you want to start Medicare on your effective date, which is usually the first of the month that you turn 65. Unless you're born on the first of the month, then you get it the first of the previous month. Thank you for watching The Truth About Medicare. Here's how we may be contacted: 1-800-762-7572. You can email us at mark@MedicareMark.com. You can look at our website, MedicareMark.com. You can also call 1-800-7-MARK-72. It's the exact same number as above, but with the word in the middle. I am Mark Lumia, a.k.a. Medicare Mark. Here are some of our other Medicare insurance experts. These are agents that work in Florida. We do have agents in other states. If you are watching this video and you found it on the internet and you're in a different state, please, you can still contact us because we do have agents in other states. But here you see Roe and Kathy, Jose, Tom, Cindy, and Sterling. Some more of our Medicare experts: Rick, Tina, Kelly, Scott, and Deborah. You can also search for our podcast, The Medicare Minute, and get more information about your Medicare. Once again, thank you. We look forward to talking to you. Give us a call and we can answer all your questions. Once again, MedicareMark, where you get clear solutions to your Medicare questions.